Trenbolone stands as one of the most powerful anabolic steroids ever developed. Originally created for veterinary use to promote lean muscle growth in cattle, among bodybuilders, it has earned a reputation as both the ultimate physique enhancer and one of the most dangerous compounds in performance enhancement. At 1000 milligrams per week, Trenbolone acetate or enanthate pushes the boundaries of human biochemistry, delivering dramatic physical transformations alongside severe physiological and psychological consequences. Anabolic power and physical transformations. Trenbolone's molecular structure makes it 3 to 5 times more anabolic than testosterone, while exhibiting strong androgenic activity. At 1000 milligrams weekly, the drug's effects on muscle growth become extreme. Users report rapid recomposition effects, simultaneous fat loss, and muscle gain matched by other steroids. The compound's ability to enhance nutrient partitioning means more calories are directed toward muscle tissue rather than fat storage, creating a shredded vascular appearance even at higher body weights. Strength gains reach extraordinary levels, with some lifters adding 50 to 100 pounds to major lifts within weeks. Trenbolone uniquely increases the central nervous system's ability to recruit muscle fibers, allowing for performance beyond natural limits. The drug also boosts red blood cell production and glycogen storage, enhancing endurance and creating the characteristic full look prized in competitive bodybuilding. However, these dramatic effects come with equally dramatic trade-offs. The body's capacity to benefit from such extreme androgen levels eventually plateaus, while side effects continue accumulating exponentially. Many experienced users find 400 to 600 milligrams weekly provides nearly the same muscle-building results with significantly fewer complications. Cardiovascular and respiratory stress. Trenbolone's impact on the cardiovascular system makes it one of the most dangerous steroids at high doses. The compound severely disrupts lipid metabolism, crashing HDL cholesterol to single-digit levels while elevating LDL cholesterol. Autopsy studies of long-term Trenbolone users show advanced atherosclerosis comparable to lifelong smokers. Blood pressure often skyrockets into hypertensive crisis territory, compounded by the drug's tendency to cause water retention despite its dry aesthetic effects. The most distinctive cardiovascular effect is tren cough, a sudden, violent coughing fit that occurs when the drug crystallizes in pulmonary capillaries. At 1000 milligrams weekly, these episodes become frequent and severe, sometimes causing users to collapse during injections. Long-term Trenbolone may cause pulmonary fibrosis, permanently reducing lung capacity. Hematocrit levels frequently exceed 55% at this dosage, creating dangerously thick blood that increases stroke risk. Many users require regular therapeutic phlebotomies to manage this polycythemia. Cardiac remodeling occurs rapidly, with left ventricular hypertrophy developing within months. Arrhythmias become common, and the risk of sudden cardiac death increases substantially. Neurological and psychological effects. Trenbolone's impact on the central nervous system is unparalleled among anabolic steroids. The drug alters dopamine, serotonin, and GABA neurotransmission, leading to profound psychological changes. Tren rage becomes a genuine concern at 1000 milligrams weekly, with users reporting uncharacteristic aggression, irritability, and even violent outbursts. The psychological profile resembles stimulant psychosis in some cases, with paranoia and delusional thinking occasionally appearing. Sleep architecture disintegrates completely. Most users experience severe insomnia, night sweats, and vivid nightmares, described as more real than reality. Cognitive function declines, memory formation becomes spotty. Verbal fluency decreases, and many report a persistent mental fog. Some develop a condition bodybuilders call tren brain, characterized by impaired judgment and decision-making. The drug's impact on stress response is particularly concerning. Trenbolone amplifies the effects of cortisol in certain tissues while suppressing normal HPA axis function. Users often find themselves stuck in fight-for-flight mode, overreacting to minor stressors while unable to handle actual challenges. Many report developing anxiety disorders that persist long after discontinuing the drug. Endocrine system disruption. Trenbolone shuts down natural testosterone production more completely than almost any other steroid. At 1000 milligrams weekly, luteinizing hormone and follicle-stimulating hormone levels drop to zero within days. Testicular atrophy occurs rapidly, with many users experiencing 70 to 80% reduction in testicle volume. Unlike testosterone, Trenbolone provides no estrogenic activity to support bone density, libido, or cognitive function. Prolactin levels skyrocket, leading to lactation in some users. Sexual dysfunction becomes common despite enhanced libido, a condition bodybuilders call Trendic. Post-cycle recovery is extraordinarily difficult, with many users requiring months of HCG and serum therapy to regain even partial natural function. Some never fully recover, becoming dependent on testosterone replacement therapy for life. Hepatotoxicity and renal stress. While not a 17-alpha-alkylated compound, Trenbolone still stresses the liver through alternative pathways. Liver enzymes often elevate 3 to 5 times above normal ranges. Kidneys face equal challenges: increased protein metabolism. Mineral imbalances and hypertension combine to reduce glomerular filtration rate. Many long-term users develop stage 2 or 3 chronic kidney disease after prolonged high-dose Trenbolone use. Physical side effects: the drug's androgenic effects become extreme at this dosage. Acne erupts violently, often covering the back, shoulders, and face with painful cystic lesions. Hair loss accelerates dramatically in those genetically predisposed to male pattern baldness. Body hair growth increases noticeably, while some users report changes in hair texture. Trenbolone's progestogenic activity frequently causes gynecomastia that resists standard anti-estrogen treatments. Many users develop permanent breast tissue requiring surgical removal. The drug also causes a distinctive trend look, exaggerated facial bone structure, thickened skin, and a hardened, grainy muscle appearance that experienced bodybuilders recognize immediately. The bodybuilding paradox: ironically, the very physique Trenbolone helps create becomes increasingly difficult to maintain. As androgen receptors downregulate, users require ever-increasing dosages to preserve their gains. The cardiovascular damage limits training capacity, while joint pain from rapid strength gains makes heavy lifting difficult. Many competitive bodybuilders using these dosages develop chronic injuries: torn pecs, biceps tendons, and rotator cuff tears become almost inevitable. Long-term health consequences: the prognosis for long-term high-dose Trenbolone users is grim. 80% develop hypertension requiring medication by age. 40–60% show significant coronary artery disease on angiography. 50% require testosterone replacement therapy for life. 30% developed chronic kidney disease. 20% report persistent psychiatric symptoms, perhaps most tragically. Many users find the drug's psychological effects linger indefinitely. The personality changes, anxiety disorders, and cognitive deficits often outlast the physical side effects, permanently altering users' lives. Conclusion: 1000 milligrams of Trenbolone weekly represents bodybuilding's Faustian bargain, paralleled physical transformation in exchange for devastating health consequences. While the short-term results can be spectacular, the long-term costs to cardiovascular, neurological, and endocrine health are simply too great. Modern approaches to performance enhancement increasingly emphasize lower dosages. Careful health monitoring and recognizing that no competition trophy is worth a shortened lifespan filled with chronic illness. For those considering such extreme usage, the ruined lives of those who came before stand as the most powerful warning possible.